Kansas Governor Laura Kelly clarifying how many people will be vaccinated in the first phase of the coronavirus vaccine plan. KSNT News Capitol Bureau reporter Rebecca Chung is live to tell us more about the changes to the state's plan. Rebecca.
Kelly, the governor said earlier this week that Kansas could receive up to 150,000 doses of the Pfizer and Moderna two-dose vaccines. Now today she clarified that statement, and she said 150,000 is in reference to the number of people that are expected to get a single dose of the vaccine by the end of this month. And that includes essential workers and people working with coronavirus patients. Now, in her weekly coronavirus update on Wednesday, she did warn that the early stages of the state's plan will be fueled with uncertainty.
As happened early on in the pandemic, I anticipate information and guidelines will be amended and evolve rapidly.
Approval for the vaccines is still needed. The FDA is set to act on approval for Pfizer's vaccine December 10th, then Moderna's shortly after. If the vaccine gets approved, the state could receive its first shipment of more than 23,000 vaccines from Pfizer by mid-December. Now, it's important to remember that this plan is subject to change in the coming weeks as more recommendations are made available, and we will be updating it online for you at KSNT.com. Live at the Capitol, I'm Rebecca Chung.
Thank you, Rebecca. The governor is also updating information about who gets vaccinated first in Kansas, and as of now, there are 5 different phases. Phase 1 will include healthcare workers working with coronavirus patients in hospitals, as well as employees and residents at long-term care facilities. Phase 2 will include essential workers as they've been defined during the pandemic. So right now for Kansas, this means first responders and people working in education. Kansas also considers grocery store and meatpacking plant employees as essential workers too. In later phases, the vaccine will go to people in Kansas who are 65 and older, as well as people with high medical risk regardless of their age. Last in line will be the healthy population under 65.